Hello, how are you? My name is Nurse Pauline RN. The title of this video is Fundamentals of Nursing, and this is exam 1 and this is part 8. Please hit your like button, please subscribe, and please share this video. Today we have questions and answers. Your H&H is low. Your hematocrit and hemoglobin is low. What order are you expecting from your doctor? You are expecting your doctor to order a blood transfusion for your patient. Before you administer this blood transfusion, the doctor will make sure the doctor will sign your consent, and the nurse will be the witness for the consent. If your patient is Jehovah's Witness, the patient has the right to refuse. Before you administer your blood transfusion, make sure you have a reliable IV. Make sure you have a number 20 IV. It's not leaking any fluids, no blood. The site is not red. The site is not swollen. Make sure your IV is patent, ready to go. You need to assess your patients in the mornings for signs and symptoms of dehydration. How do you assess for signs and symptoms of dehydration? You'll assess thirst, weight loss, dry mucous membranes, sunken appearing eyes, decreased skin turgor, increased capillary refill time, hypotension, low blood pressure, tachycardia, elevated heart rate, weak peripheral pulses, flat neck veins. What is normal capillary refill? Normal capillary refill is less than 2 seconds. Capillary refills measures how well your vascular system is working. Your patient comes in and your patient is complaining of flank pains, a dull aching pain in the back, the mid-back, on one side of the back. It's most likely these are symptoms of kidney stones, flank pain, dull pain, mid-back to one side. Your patient is admitted and is complaining of right lower quadrant pain. The patient tells you, I'm having pains in maybe my belly button, and it's radiating down to my right lower abdomen quadrant. It's most likely these are signs and symptoms of, the answer is appendicitis. Do you know what Romberg Test is? Romberg Test is used to identify and diagnose imbalance. This is a test for balance. Patient is complaining of dizziness. Patient is having frequent falls. Romberg test is a test for balance. CVA. What is the definition of CVA? Cerebrovascular accident. This is an emergency. This is a stroke. You go into your patient's room. The call light is on. Nurse, I'm experiencing paralysis on my right side. My face on the right side is drooping. My eyelids is drooping. I'm having slurred speech. These are all signs of a stroke. Stroke means there is blood flow that has stopped in part of your brain. There is some blockage in your brain. There is some rupturing of your blood vessels in your brain. This is an emergency. Slurred speech. Patients with stroke, they'll have double vision, they'll have vertigo, they'll have severe headache, signs and symptoms of hypertension, high blood pressure, loss of balance. These are all signs and symptoms of stroke you have to know. No signs of symptoms of patient ring the doorbell complaining for nurse, I'm having chest pain on the left side. Your assessment of your patient, does your pain radiate down your left arm? This could be a sign and symptoms of heart attack, chest pain. This is emergency. Call the meds team, call the doctor immediately. If you have nitroglycerin, ordered PRN in the Pixies. PRN, nitroglycerin, is ordered sublingually under the tongue until the doctor gets to the room. Do you know what Babinski sign is? Babinski sign is a neurological assessment we do on the newborns. Babinski signs tells how well the neurological central nervous system is doing at birth. Do you know why we use a cervical collar? Doctor has ordered a cervical collar. A cervical collar is used for spine and neck injury. It is used to support the neck and spine. It is also used for after neck surgery. Doctor has ordered an abdominal pillow post-operatively, maybe after the mom has her baby, maybe after hysterectomy, maybe after hernia repair, abdominal surgery, bariatric surgery. The abdominal pillow is used to support the abdomen. Patients have a lot of pain in the abdomen. It's held to the abdomen when patient is laughing, sneezing, coughing, trying to pull themselves up and down in bed, right side, left side. Abdominal pillow is used to assist the patient to get in and out of bed. When your patient's potassium is elevated, you look at your labs this morning, you notify the doctor. What order are you expecting for high potassium? You will expect the doctor to order lactulose. Lactulose is a laxative that helps in reducing potassium. While you're inserting an NG tube, you're assessing for nasal patency. If the nostril is not patent, what do you ask your patient? What do you assess? Ask your patient if he or she has had a history of nasal surgery. Ask your patient, have you had a history of deviated nasal septum? When you're inserting an NG tube, it has to be inserted in the more patent nostril. Ask the patient, which nostril would you prefer me to insert this tube in? NG tube comes in different sizes. If the regular size is not working, there are much smaller ones you can use. Otherwise, you can ask your doctor for assistance. And all NG tube has to be verified by X-ray before use. Do you know what a bladder scan is? Your patient is supposed to be voiding 30 cc the least an hour, especially your post-op patients. Some patients do not void even 30 cc a day, 24 hours. Those are your dialysis patients. Some dialysis patients do not void at all for 24 hours. Those are anuric patients. But in a patient whose kidney is functioning well, they should void greater than 30 cc's an hour. Your patient, especially your post-op patients with abdominal surgery, they are at risk for hemorrhage post-operatively due to urinary retention. Make sure your patients are getting that urine out to prevent hemorrhaging. You notify your doctor your patient is not voiding 30 cc's an hour. The doctor will order a bladder scan. A bladder scan the nurse takes to the bedside and scan the abdomen to see how much residual urine the patient is retaining in the abdomen. You get the number and you will report back to your doctor. Thanks for listening today. Please hit the like button. Please subscribe. Please share. Thank you very much. Stay tuned to exam 10 coming up. Thank you.